The Voices of Cushing's Disease, a 360-degree look at the condition. Part 2, Managing Cushing's Disease, a day in the life. Managing Cushing's disease requires understanding the day-to-day hurdles that come with the condition and the importance of support. Patients should monitor their cortisol levels to reduce the physical complications associated with Cushing's disease. In addition, they must learn to cope with serious psychosocial effects. Listen to the experiences of some people impacted by Cushing's disease and the adjustments they've had to make to cope in their daily lives.
On a day-to-day basis, for patients, a diagnosis of a pituitary disorder, whether it's Cushing's, acromegaly or any other condition, it affects everything in their day-to-day life. Some patients might not be able to work anymore, so they may feel guilty that they can't work.
And depression is a part of Cushing's, right? And being fat all of a sudden causes even further body issues, which often leads to depression. So it's kind of, you're on an uphill battle that's really hard.
I lost a lot of self-esteem. I seemed to have a lot of brain fog all the time, I know, and I also had anxiety, more than what I would normally have. I look back through the photographs, family photographs, and they're all of my husband with the kids because I hated being photographed. I suppose every person worries about relapse. I've seen people who haven't been cured, and I've heard of people that have had relapses many years later. So that's something always on your mind. I think within the first couple of years post-operatively, I recall having a couple of nightmares where the thing was back and I woke myself up with fright.
If you know some of the problems that you could face, you've got the medication there, you address it, and then you get on.
I have some adrenal insufficiency now, so I carry cortisone with me wherever I go, and I'm very decisive about activities that I might engage in, whether I can cope with those, my body can cope with those or not.
Voilà, donc en fait, je pense que la maladie de Cushing, pour l'instant, accompagne ma vie. J'espère que je n'aurai pas d'autres problèmes dans le futur avec cette maladie. Voilà, et puis mon rêve dans une vie idyllique, ça serait d'avoir un rythme du cortisol normal.
I would say that I wouldn't have asked this to happen to me. I wouldn't have. But in a kind of way, I'm really, this sounds really nuts, but I'm really glad this happened to me because I can deal with this.
Cushing's disease is a multidimensional condition with various elements to manage, including cortisol levels, physical changes, and the psychosocial impact. Regular and transparent communication with a healthcare professional should help with navigating and coping with Cushing's disease. Please visit cushingsdisease.com in the U.S. or aboutcushings.com outside of the U.S. to learn more about the disease and to acquire resources and supportive materials.